Okay, let's dive straight into a really critical topic today, using the source material you've provided. We're doing a deep dive into ventricular asystole in animals.
A very serious one.
Absolutely. So, just in simple terms, ventricular asystole. It's basically when the heart's main pumping chambers, the ventricles, they've just stopped their electrical activity, right?
That's the essence of it, yeah. No electrical signal means no effective beat.
And our source for this deep dive, it's a veterinary reference text. It covers the diagnosis, causes, treatment, specifically for dogs and cats. So everything we talk about today, it's coming entirely from this material.
Right. And it's important to set the stage, like the source does. This isn't just a bad rhythm, it is cardiac arrest. It's often fatal, and that window for doing anything helpful is incredibly small. So our goal here is really to unpack what the source tells us, recognizing it, why the text says it happens, and the immediate actions described for vets.
Exactly. Consider this our mission.
Yeah.
We navigate this dense source material together, pull out the key insights for you, the listener. We'll look at the definition, what it actually looks like on an ECG monitor, what's going wrong underneath, the causes listed, the signs you'd see, and then diagnosis and the treatments described.
Sounds like a plan.
Okay, so starting right at the beginning, based on this reference, what exactly is ventricular asystole?
Well, the source defines it pretty clearly as the absence of ventricular complexes on the ECG, so no electrical sparks from those main pumping chambers. But it also mentions something called electrical mechanical dissociation.
Ah, okay. What's that?
That's where you might still see some kind of electrical rhythm on the screen, maybe bizarre looking, but there's no actual pulse, no effective cardiac output. The electricity isn't making the heart pump. Functionally, it's still cardiac arrest.
Got it. So it's not just a flat line, it could be useless electrical noise too. Okay, what does this crisis look like on the ECG monitor then? The source mentioned specific features.
It does. Key features. The big one is no QRS complexes. Those sharp spikes representing ventricular contraction. Gone.
Right.
Now, P waves showing the atrial activity, they might still be there.
Oh, when would that happen?
According to the source, that happens if the problem is a complete AV block. The signal starts in the atria, making P waves, but it just doesn't get down to the ventricles.
Okay, so the top chambers are trying, but the message isn't received below.
Exactly. But the source also says P waves might be totally absent too.
And why would that be?
That could happen if the issue is higher up, like a severe sinoatrial block or arrest.
Yeah.
The heart's main pacemaker itself isn't firing properly.
Huh. So the ECG pattern itself can give clues about where the electrical failure might be originating.
Precisely. The source even uses figures to show this. Figure 1 is described as a dog with severe complete AV block. You see P waves, but no QRS following.
Just P waves marching along alone.
Yeah. And figure 2 is different, a cat with severe hyperkalemia, high potassium. There, after some initial weird complexes, there are no P waves and no QRS complexes. A total electrical standstill, essentially.
And it specifically links that cat's case to high potassium from a urethral obstruction, potassium level of 11.
Yes, 11 MEQL. It really highlights how a metabolic problem can directly cause this electrical failure.
Wow. Okay, let's shift from the ECG pattern to the pathophysiology. What's actually happening inside the animal's body, and what are the immediate consequences described?
The source is very direct. Ventricular asystole is cardiac arrest, full stop. And the most critical consequence it points out, that time window, if you don't get a ventricular rhythm back within 3 to 4 minutes,
Only 3 to 4 minutes.
irreversible brain injury is likely. It's incredibly fast.
That is terrifyingly fast. Which body systems are immediately impacted, according to the source?
Well, obviously the cardiovascular system has failed. But because of the complete loss of perfusion, no blood flow, the source states that all organ systems are affected almost instantly.
Everything suffers from lack of oxygen.
Everything. Brain, kidneys, liver, all of it.
Does the source mention if certain animals, like specific breeds or ages, are more prone to this?
It confirms it happens in dogs and cats. But beyond that, no. The source lists breed predilections, mean age, genetics, geography, incidence, all as unknown or not applicable based on the information they have.
Okay, so it can happen to potentially any dog or cat facing the underlying causes. What would someone actually see clinically? What are the historical and physical exam findings described?
History-wise, the source says these animals often have a background of severe systemic illness or known heart disease. Sometimes other arrhythmias might have been seen leading up to it.
Right, some warning signs maybe?
Maybe. And the physical exam findings, they're stark, as the source describes. No palpable ventricular pulse, overt cardiac arrest, collapse, and ultimately death if things aren't turned around immediately.
A very clear and grim picture indeed. What does the source list as the specific causes for this kind of shutdown?
It points to a few main culprits. One is complete AV block, where the signal doesn't get through, and critically, no backup rhythm starts up from lower down.
No escape rhythm takes over.
Exactly. Another is severe sinus arrest or block. The main pacemaker just quits or slows dramatically.
Okay.
And the third major one listed is severe hyperkalemia, that high potassium we mentioned with the cat example.
That urethral obstruction case again?
Yeah, it seems to be a key example in the source showing how electrolyte issues can stop the heart electrically.
So it's not always primary heart muscle disease. Systemic problems are key too. What factors increase the risk of these underlying causes happening?
The source links risk to severe systemic illness generally. It specifically flags severe acidosis, the body being too acidic and hyperkalemia again.
Right.
Existing heart disease makes an animal more vulnerable, naturally, and conditions known to cause that dangerous hyperkalemia, like hypoadrenal corticism, Addison's disease, or urinary tract issues like rupture or obstruction, those are highlighted as significant risk factors in this text.
Okay. Moving towards diagnosis. Given the extreme urgency, how is it definitively diagnosed, according to the source?
Primarily, and most rapidly, it's the ECG. Seeing that absence of ventricular complexes, that's the diagnostic hallmark.
Just the flat line, essentially, for the ventricles.
Or close to it. But the source adds a really crucial practical point. Always rule out artifact first.
Like a loose lid.
Exactly. Check the clip contacts, make sure you've got good conduction with alcohol or gel. You absolutely don't want to start aggressive CPR because a lead fell off.
Very good point. Extremely practical. Does the source mention other diagnostic tests, maybe to find those underlying causes?
Yes. While the ECG diagnoses the asystole itself, the source recommends follow-up tests like a CBC, biochemistry panel, and urinalysis. These are vital for looking for those underlying issues, especially severe hyperkalemia or signs of systemic illness.
Makes sense. Find the why.
Right. Systemic blood pressure, naturally, would be absent, confirming the clinical picture, but it's not the primary diagnostic for the rhythm. Imaging, other labs, pathology. The source lists those as not applicable for diagnosing the asystole event itself.
Understood. Okay, the source is pretty blunt about the prognosis being poor, but what treatments are described as appropriate immediate actions?
Yeah, the source emphasizes it's frequently fatal and needs immediate aggressive treatment. It does mention artificial pacing.
Like with a pacemaker.
Yes, a transvenous pacemaker. It might work, the source says, but only if the heart muscle itself is still capable of responding mechanically.
Okay, so the muscle has to be viable.
Right. And it makes a very important point about defibrillation using shocks.
What does it say?
It says DC electrical conversion is not effective for asystole. You can't shock a flat line back into rhythm, according to the source.
Right.
Unless, it notes, you could first convert the rhythm to ventricular fibrillation using drugs. But that's a whole complex maneuver in itself during a code.
So, shocking isn't the first-line tool here based on this text. What about general nursing care or management?
Beyond CPR and drugs, the focus described is treating any fixable underlying problems. Things like getting the body temperature up if they're hypothermic, correcting severe hypokalemia, dealing with severe acid-base imbalances. Those are priorities.
Treat the cause if you can identify it quickly.
Exactly. Things like activity level, diet, the source lists those as not applicable. The animal's in critical arrest.
Understandable.
Same for surgical considerations for the asystole itself. Surgery might be needed later for an underlying cause, like that blocked cat, but not for the arrest event.
Okay, let's get to the core interventions.
Yeah.
The medications. What does the source list as the drugs of choice right away?
First and foremost, institute CPR immediately. Then specific drugs listed are epinephrine, atropine, and sodium bicarbonate.
Okay, the standard ACLS drugs, essentially. What about dosages?
Epinephrine is listed at 0.2 millikilojoules IV, IT intratracheal or IL, intralingual or intracardiac, though IVA preferred. Double the dose for IT mixed with saline.
Got it. Epi first.
Then atropine at 0.05 millikilogram. Same routes, IV, IT, IL, and again, double the dose with saline for IT.
Okay, atropine 2. And sodium bicarb.
Sodium bicarbonate is recommended at 1 lg/kg IV for every 10 minutes that the animal has been in arrest to combat the severe acidosis that develops.
Right, addressing the acidosis.
And the source adds a little note. Dexamethasone and dopamine may be helpful, Potentially, in those cases of electrical mechanical dissociation we talked about earlier.
Where there's electricity but no pump?
Okay.
Yeah, trying to improve the mechanical function, perhaps?
Are there any drugs the source flags as definite don'ts contraindications?
Yes. It specifically warns against drugs that depress the sinus node or AV node conduction if you know the asystole is due to sinus arrest or heart block.
Like what drugs?
Examples given are beta blockers, calcium channel blockers, and digoxin. You don't want to slow things down even more in those cases.
Makes perfect sense. Any alternative drugs mentioned?
Mm.
Just one, specifically. Calcium gluconate. It's listed as an alternative only for patients with ventricular standstill caused by hyperkalemia.
Directly counteracting the hypotassium's effect on the heart.
Exactly. It's treating that specific underlying electrolyte cause. The source lists precautions and interactions generally as none in the context of the immediate arrest treatment itself.
Okay, now, if the animal beats the odds, if they're resuscitated, what does the source say about follow-up and monitoring?
Survival is rare, the source stresses, but if they are resuscitated, it recommends running that full panel again, CBC, biochemistry urinalysis, to really investigate underlying causes.
Try to figure out why it happened.
Yes, and if primary heart disease was suspected initially and the animal survived the arrest, then an echocardiogram, heart ultrasound, and chest x-rays are suggested.
Makes sense. Assess the heart structure and function.
And critically, the source says ECG monitoring should be close and frequent, continuous if possible,
Why the intense monitoring?
because, as we'll get to with prognosis, rearrest is unfortunately common according to this source.
Right, okay. Can this even be prevented? What does the source say about prevention?
Well, direct prevention of the event itself is hard, but the source suggests careful monitoring of any critically ill patient is key, proactively identifying and correcting things like severe acid-base problems, low blood pressure, hypotension, low oxygen levels, hypoxemia.
Trying to head off the potential causes before they trigger the arrest.
Exactly. Managing those risk factors in vulnerable patients is the main preventative strategy described.
And what about complications if the animal doesn't die immediately but survives the initial event?
Death is listed as the primary complication, bluntly. But for those who survive temporarily, the source mentions risks like DIC.
Disseminated intravascular coagulation, like widespread clotting issues.
Yes, a very serious systemic problem. And also multi-organ failure due to the initial lack of perfusion during the arrest.
The damage done during those few minutes can have lingering severe effects.
Precisely. Which brings us back to the expected course and prognosis. What's the bottom line from this source?
I have a feeling I know, but what does it say?
It's very direct. Animals usually die.
Usually die.
Yes. And even if you manage to reestablish a sinus rhythm, get the heart beating normally again for a bit, the prognosis is still usually guarded to poor. It explicitly states it's not uncommon for the animal to arrest again shortly after.
Wow. That really underscores just how devastating this condition is. A true worst-case scenario. And the interventions described, while aggressive, face enormous challenges according to this source.
Absolutely. It highlights the extreme fragility of the heart's electrical system when facing severe insults, and that incredibly narrow time frame where the interventions outlined here might make a difference, but often the outcome is still, well, poor.
We've definitely taken a deep dive into this veterinary source, pulling out its descriptions of recognizing, understanding the causes, diagnosing, and attempting to treat ventricular asystole in dogs and cats. Hopefully, walking through this material together helps clarify the clinical picture and the management approaches described in the source for this incredibly severe emergency.
Yeah, exploring the source material on asystole really makes you think about the sheer complexity and the rapid, critical decisions needed in veterinary emergency medicine. Milliseconds matter.
Reflecting on everything this source detailed, the causes like hyperkalemia, the specific drug protocols, the very grim prognosis, what aspect of this deep dive stands out most to you regarding the challenge of these cases?